Another real common question I get during these informational seminars is, what about the excess skin after I lose all this weight? And the bottom line is about 25% of our patients who have bariatric surgery go on to get reconstructive surgery of their abdominal wall. Some have surgery of their abdominal wall, some have surgery addressing the excess skin of their upper arms or their legs. But about 25% of our patients get it. And that means about 75% of our patients don't get it. And whether or not you get plastic surgery will depend on you. The only thing I can say to predict whether or not you're going to need it is it depends on how you're built. It depends on your age. It depends on your sun exposure. But it's really difficult to predict. I've seen patients who have lost a great deal of weight who don't look like they need anything, and patients who have lost a small amount of weight who definitely could use the help of a plastic surgeon. So it's difficult to predict. I think some patients feel that if they lose it fast, they'll get more excess skin, and if they lose it slower, they'll get less excess skin. This is probably not true. I've had patients say, I want to get the gastric band because the weight loss is slower, and that way I'll have less excess skin. This is probably not true, in my opinion. It really depends on your age and sun exposure and where you carry all this excess weight and you know, your body shape. And I tell patients that be patient on this. Wait until you reach your baseline weight to decide whether or not you're going to need it, and don't be rushed into this. When you're ready and you know that it's the right thing for you, then it'll be time. One thing, a little caveat I do want to say is be careful picking the plastic surgeon. There are some plastic surgeons who have a great deal of experience in this, and they work specifically with bariatric programs, and I think experience is always helpful. For instance, our program, we have 2 plastic surgeons who work here who do this regularly and get very good at it. So be careful about choosing a plastic surgeon who has significant experience in this post-bariatric abdominal or post-bariatric body contouring surgery.